video series at the Neurology. Let's discuss the newer treatments for Alzheimer's disease. That has actually created a lot of questions nowadays, a lot of discussion. Alzheimer's disease, of course, is one of the biggest issues we have, especially as the population grows older. A lot of people are unfortunately underdiagnosed with Alzheimer's. Almost rarely is anyone overdiagnosed. It's almost always underdiagnosed. It's always dismissed due to aging or this commonly used wastebasket term really called vascular dementia when it's typically Alzheimer's. In the last few years, we have these new medications which target the amyloid buildup in the brain. The anti-amyloid medications, which are monoclonal antibodies called, there's only one on the market right now called Leqembi, and the brand name is Leqembi. There's another one which is coming out soon, which is Donanemab, but that hasn't been released yet. And there's still other medicines also in the pipeline, not only targeting the amyloid in the brain, but also targeting the insulin receptors and also other filaments as well involved in the pathogenesis of Alzheimer's. So that we have a lot of promising new developments regarding Leqembi, which is the only medicine right now on the market available for patient use. The effectiveness has definitely been shown. And it's recommended for anyone with early Alzheimer's disease below a certain age, so they have to be below 85 for it to be approved by insurance. Unfortunately, they also need either a lumbar puncture showing a decreased AB40-240 ratio in the spinal fluid, or they need an amyloid scan, a PET amyloid scan, which is not covered by insurance. So they have to do one of those two tests, as well as MRI and other testing. But those really are the main two tests to show. You have to show positive results for the insurance to approve Leqembi. Once the Leqembi is approved, we send them to an infusion center to get the Leqembi infusions. We have to do serial MRIs to make sure there's no area or hemorrhage really, or edema in the brain, which can occur as a side effect to Leqembi. Even if there's a little bit of hemorrhage or edema, that doesn't necessarily mean we have to stop treatment. Only if it's excessive we do. But I believe personally that the benefit of the medication far exceeds any possible side effects which can occur, because Alzheimer's itself is so debilitating. I would really treat it with any means possible to reduce the burden of the disease for both the patient and the caregivers.